Next, from Springfield, Illinois Veterans Affairs Director Tammy Duckworth discusses health care for veterans. Director Duckworth, who is herself a wounded veteran of the war in Iraq, discusses federal and state benefit programs and what her department is doing to meet the expected rise in veterans' health care costs as the population of Illinois veterans ages. This runs about 50 minutes. This program is sponsored in part by the Center for State Policy and Leadership at the University of Illinois at Springfield and by the Institute of Government and Public Affairs at the University of Illinois.
My name is Anthony Halter. I'm the Executive Director of the Center for State Policy and Leadership. I would like to welcome you to this policy luncheon that is co-sponsored by the Institute for Government and Public Affairs and the Center for State Policy and Leadership. I am pleased to introduce Tammy Duckworth, Director of the Illinois Department of Veterans Affairs, who will be speaking about veterans' health care, how Illinois is addressing unmet growing needs with state programs. Tammy Duckworth was appointed director by Governor Blagojevich on November 21st, 2006. She was manager for Rotary International's Asia Pacific region from 2002 to 2004. From 1991 to 2001, she coordinated the Center for Nursing Research at Northern Illinois University. At that position, she also served as the School of Nursing's liaison to the media, local governments, and citizens. She grew up in Southeast Asia, the daughter of a U.S. Army officer. She speaks 4 languages, has a BA in political science from the University of Hawaii, earned a master's degree in international affairs at George Washington University, wanted to pursue a career as a diplomat, but she also felt called to the military, enlisted in the Illinois Army Reserve in 1992. I could go on, but Tammy asked me to make this short, so I will. Ladies and gentlemen, it is my distinct pleasure to welcome Director Tammy Duckworth.
Thank you. Well, it's a pleasure to be here, and I want to say hello to Senator Dumuzio, who I ran into at the elevator. I get very single-minded as I'm trying to get out of the elevator. I'm here to speak with you about the cost of war in terms of our veterans. And what I'm posing to you, and as I speak, I'd like for you to consider this as you're thinking of the questions that we're going to go into for our discussion session, is the fact that the cost of taking care of our veterans is really a cost of the war in Iraq and Afghanistan that has really not been made public to the American people. So that when you get the roll-up in the media of this is what the wars in Iraq and Afghanistan cost, that total amount does not include what the amount is for the Department of Veterans Affairs at the federal level to take care of our vets, but also for individual states. And this is very important consideration to make because already the state of Illinois had shifted quite a lot of the burden for taking care of our veterans onto the shoulders of the Illinois taxpayers, the citizens of Illinois. And this is with full support of our legislators who basically saw that our veterans were not being treated adequately, were not being cared for adequately, and so the state of Illinois is going to stand up and make sure that we take care of our veterans, especially when they start falling through the cracks because the federal VA system simply is either unprepared or not sufficiently funded. I'm just going to start off by giving you some basic information. So far, 1.4 million veterans have been deployed in support of the global war on terrorism. That's the Pentagon's name for the wars in Iraq and Afghanistan. In short, they call it GWAT. So if you ever hear military types throwing out the term GWAT, that's what it stands for, Global War on Terrorism. 1.4 million have deployed. 50% of that number are National Guardsmen and reservists. It's the first time in our nation's history that National Guardsmen and reservists have been such a major component of force going off to war. And the difference between Guardsmen and reservists is in the military, I'll just talk about the Army as an example. The United States Army Reserves is just like what you think, weekend people who drill on weekends, 1 weekend a month, 2 weeks a year. They have civilian lives, regular jobs. They are a federal force. The National Guard is also made up of citizen soldiers, but in addition to being a federal force, they are also able to be activated by the state of Illinois. So we have in our chain of command in the National Guard, Governor Blagojevich as the commander-in-chief at the state level. So there is one more apparatus so that you can be activated for state emergencies as well as federal emergencies. And what this does is, this is the beginning of where these federal requirements start to take away funding and start to take away resources from the state level when you start involving National Guardsmen, who, by the way, are well-trained, are extremely happy to do their job, and really see it as an honor to be deployed and be a part of the fight in the global war on terror. But it presents some real issues for us at the policy level, because now you have this large number of veterans coming home who are of a young age, who are coming home back to civilian jobs, and you have pressures that are not only pressures on their families, but their employers and their communities as well. We have entire towns in Illinois where the entire leadership of the town, the city council, the mayor, the police chief, the fire chief, have been deployed. And when that unit gets deployed, everybody in that town goes. My husband's unit is a good example. The 11th 44th Transportation Battalion is located in a small town in Delavan, Illinois. And when they left, that town emptied out of its men. And they're over there in Kuwait right now running convoys in and throughout Iraq. But that puts great pressure on the business community as well as on their, when it's your police chief and your fire chief who gets deployed, that really affects your emergency preparedness issues back at your hometown at the state and municipal levels as well. Let's talk about the cost, what the current healthcare needs are for veterans. The VA is a system that, the federal VA, is a system that simply was not prepared for the length and severity of the wars in Iraq and Afghanistan. They were not funded adequately. They have wonderful people working within the VA. I'm going to be going to Hines VA, my VA hospital here next week. All the staff there that I've worked with have been wonderful, caring people, but they're simply not resourced sufficiently to take care of veterans. In Illinois, the U.S. VA estimates, they know of 850,000 veterans living in the state of Illinois. These are 2006 numbers. We suspect at the state level that there are 1.2 million, because that 850,000 veteran number are actually veterans who have registered themselves. We think that there are at least another 400,000 to 500,000 veterans who never bothered to register their service. And you sort of wonder, well, why would they do that? Some of that is a legacy from World War II, Korea, and Vietnam. The World War II and Korean vets, there's a group, the women, the WACs, don't think of their service as military service, so they don't think of themselves as veterans. And I don't know how many WACs I've run across, or waves, or and I've had to convince them, no, you're a veteran and you have earned these benefits, but they never bothered to register themselves. So they're missing from that number that the VA has. You also have a lot of World War II and Korean War veterans who served during the era but never were deployed overseas. And as part of that generation, and we all have friends and family members from that generation, they don't see that as military service. I was just doing my part here at home. I wasn't in the real fight like the other boys were in Japan or Korea or Europe. And you have to convince them, no, just because you serve stateside doesn't mean that you're not a veteran. Sign up for your benefits.